You may have been told lies that now have shortened the life of your dog. That lie, of course, being that neutering your dog will give you a happier and healthier dog. That simply isn't true. I'm sure these people that tell these lies have the best of intentions. They simply want to save dogs, as I do. However, that doesn't give anyone a license to bend the truth. Something that's undeniable scientific fact that can't be argued is that testosterone is a catalyst for building muscle. Muscle burns calories. And if you remove testosterone and have the same caloric intake, you will put on excess weight in the form of fat. Now, I know many critics will argue that if you neuter your dog, simply feed him less. Well, couldn't people just do the same? Let's face it, most people are not very good at modulating their calories, myself included, at least not anymore. And at some point, you're going to have a sit-down meeting with your dog and decide if you want to keep him hungry for the rest of his life and in good shape, or if you want him to be happier and be a bit of a chunky monkey. Now, I'm pretty sure I know how he would decide. Now, let's say you don't want to punish your dog for your bad decision of having him neutered, and you want to let him pack on a few extra lbs. Well, there's a price to pay for that. Later on in life, you can look forward to osteoarthritis. This was confirmed by a study with 12 different breeds, and what they found was the associated weight gain and the neuter itself, dogs were much more likely to have osteoarthritis. So I know what some are going to say. They're going to say a study doesn't prove anything, and I agree. Correlation does not imply causation. However, when there's a dangerous pattern that pops up, I'm going to err on the side of caution. You know, there could be a whole bunch of lawyers that will insist that Roundup does not cause cancer. It doesn't mean that I'm going to drink a glass no matter how thirsty I am. Please understand that there wasn't anything in it for the veterinarians that conducted these studies. They probably come across a lot of hate and scrutiny and criticism.
We have found the witch, may we burn her?
Due to their unpopular opinions, as I will when this video is published. There was a big study done by UC Davis, California, a very well-respected veterinarian school. And what they found was that there was a correlation between neuter and things like orthopedic issues, specifically hip dysplasia and torn ligaments, and also cancer. They also concluded that some breeds were only minimally affected or not affected at all, and some breeds were at a very great risk. So let's talk about the golden retriever first. Okay, if you have a look at this chart, you'll see that if you neuter your golden puppy early, you will have increased his chance of having a serious orthopedic issue up to 500%. In other words, you go from a 5% chance to a 25% chance of him having something like hip dysplasia, torn ligaments, or other associated problems. Let's have a look at the boxer. The boxer's already a cancer-prone breed. The already bad numbers for cancer become astronomical. Think about it. At 32%, that's almost a 1 in 3 chance that your dog dies of cancer. Please don't use these tables as a litmus paper test to decide whether or not you should be worried whether neuter will affect your dog in an adverse way. You should do your own investigation. This video is for awareness only. In all transparency, I created the tables in this video by taking information out of the article that's listed in the description, as opposed to going and looking at the actual data myself. If you want to be critical of this approach, please feel free to go read the article yourself and find the data listed at the end of the article. From a logical perspective, I believe all of this makes sense. If you take testosterone, it's been known for 100 years that testosterone aids in the elasticity of connective tissue. It's been known for a long time that when you neuter a dog at a young age, the long bones grow longer and thinner, and in some cases put more undue stress on the ligaments. Cancer being affected by hormones? Is that really such a far stretch? Anyways, what I am encouraged about is the American Veterinary Medical Association is now adjusting their stance and recommendations on appropriate ages for neuter. They're trying to do something. I'm happy with this, and I'm hoping that that work continues. So you're very fortunate and you're able to dodge the bullets of weight gain, associated heart disease, osteoarthritis, joint disorders, and cancer. There's still the 800-pound raging gorilla in the room. That raging gorilla? Behavioral issues. Historically, studies indicated that neutering a dog might reduce aggression levels by as much as 50%. In other words, in half of the dogs. Most recently, studies like the CBARC study out of the University of Pennsylvania suggest that neutering actually can increase aggression, specifically in aggression towards strangers. Now, I believe the historic studies focus on dog versus dog aggression. I'm of the very strong opinion that if a veterinarian wants to recommend a neuter procedure for dog versus dog aggression, they should be able to provide at least 5 references to their client where they performed the procedure and it actually reduced aggression. I would like to suggest that if this were the case, they actually had to produce 5 references, there would be very few of these procedures done for aggression. The critics of the CBARC study want to quickly remind you and underline that the CBARC study was just an online survey and not a truly controlled scientific experiment. I'd like to suggest that doing a scientific experiment would be next to impossible to conduct because you would need tens of thousands of dogs. They'd have to be raised exactly like they were being raised by a family, and there would be so many variables to control, including the lines of dogs that you had to conduct the experiment with. If Amazon has sold 1,000 units of a product and 800 of the people that bought it give it a 5-star review, but 200 people said that after a couple of months that product began to fall apart, would you buy that product? This all boils down to tolerance for risk. The next thing you have to consider is whether or not you believe that hormones can control behavior. If you're suggesting that they can't or don't, you're basically suggesting that premenstrual syndrome and menopause are just imagined. I'm not saying that. I'm on your side, ladies. If you're a trainer and you're recommending neuter to fix aggression issues, embarrassing! I would like to suggest that a scalpel is not a training tool, and I would highly recommend that you find a new form of employment. I suggested that I was going to offer a better alternative to neuter that would help prevent procreation. That suggestion is simply to do vasectomies on dogs. You might think that sounds crazy, but there's already lots of places doing them. Now, if you ask the veterinarians that aren't doing them, they'll give you an answer like, yeah, I guess it would work. We simply don't do them, or something of that nature. Now, in most professions, you're expected to do ongoing education and training throughout your career to stay current with your skills. Why isn't this happening with the veterinarian profession? I think if vasectomies were readily available for male canines, that there's still a group of people that would be pushing for the traditional castration. Why? The aesthetics. It seems that some people like to worry about little things. I call them super Karens. They much prefer the site of mutilation over nature. I personally believe that these people need some sort of counseling, if you know what I mean. This video is primarily about the neutering of male dogs, but let's talk about the spay for a minute. With a spay, they're removing the uterus, the ovaries, and the fallopian tubes. This is a highly invasive surgery. Now consider that many rescues are doing this on dogs that are 12 weeks or less. Imagine they're hacking out all of those organs on what is the equivalent of babies. Now consider also that some of these spay-neuter clinics are sending home the dogs without pain medications. This is barbaric and inhumane. And these folks are supposed to be the kinder and gentler people of the world? The hypocrisy is so thick you could cut it with a scalpel. Yes, neuters are like Japanese war swords. Some families need them, but most don't. No, seriously, there are times or situations where some dogs should be neutered. For instance, if you live out in the country and you insist on letting your dog run loose, which I do not condone, neuter might be very necessary. The reason that I created this video is that there are lots of dogs being neutered that are not at risk of impregnating other dogs, and yet this surgery is being pushed upon these dog owners, and those surgeries are harming canine health. I just simply believe that isn't fair. I believe the public deserves the truth as to the risks of any procedure. Now, the other big thing is that these procedures done by responsible pet owners are not helping the canine overpopulation problem. Far too many dogs still die in shelters. And my very next video, I'm going to delve into why that happens. So if you're interested in that, please like and subscribe. See you in the next one.